Hi there, this is my LO for the week 9, a CVS examination. Okay, so firstly I'm going to be introducing myself to the patient and doing a general inspection and those types of things. Hi there Chris, I'm Pete. So he's going to do a general inspection right now. He's going to explain what he's going to do to the patient and wash his hands, universal precautions, that kind of thing, and get informed consent and do a general inspection looking for obvious signs of distress if he needs resuscitation immediately, that kind of thing. I'm a student doctor here.
Nice to meet you, Pete.
You too. I'd like to give you a cardiovascular examination, which involves me listening to your chest and having a feel around and trying to get some other symptoms like out of your hands and so forth like that. Do you have any questions about that?
No.
Okay, are you in any pain at the moment in your shoulder? Your back's okay? Okay, I'm just going to go wash my hands and I'll be back in a moment. So I'd go wash my hands obviously. So general inspection from the foot of the bed, looking for stuff going in, stuff going out, any IV lines, catheters, things like that, any cards and patient context. Any signs of deformities or syndromes, Downs, muffins, etc., etc. Obviously checking that the patient is not in any respiratory distress. They don't need resuscitation right now. No dyspnea, cachexia, signs of weight loss, things like that. Okay. So moving on to the hands. So just put your hands out here for me, Chris. So feeling for temperature and any sweating, looking for capillary refill, no tar, signs of tar stains, any clubbing, any wasting, just turn your hands over for me. Looking for the palmar creases, any signs of anemia or loss of colour. Okay, just put one down again for me. Now I'm going to be feeling the radial pulse here. Patient's pulse is 65 beats a minute and regular. Yeah. So I'm doing the radial delay here. There's no delay. I'd also do radiofemoral delay too, looking for aortic coarctation. Also in the hands, we're going to be doing the radial water hammer. So feeling the radial pulse for character, and just bring your hands up with me. No signs of water hammer there or aortic regurgitation. Okay, so moving on hands, up to blood pressure. Now at this point in time I'd take a blood pressure, but for time's sake I'll save that till later, till after. No, I won't do it, that is. Okay, so moving on to the face, checking for any malar flush, looking in the eye, so just look up for me please. Looking in the sclera for jaundice and the conjunctiva for any pallor, signs of anemia, and just look straight at my nose for me. Looking at the pupil for Argyll-Robertsonian signs of aortic regurgitation, xanthelasma around the eyes. Okay, just open your mouth for me and say, looking at the high arched palate suggestive of Marfan syndrome, looking at dentition suggestive of endocarditis, looking for signs of central cyanosis. No? Okay, moving on to the neck, where I'll be auscultating for the carotid bruise later. So firstly, I'll be checking the carotid character. So to do that, laryngeal prominence, cricoid cartilage, cricoid membrane, slightly lateral retracts mastoid ever so slightly. Okay, normal volume and waveform, and the other side doing them one at a time. Normal waveform and volume. Okay, so JVP, firstly looking to see if I can see it between the two heads of sternocleidomastoid. Here, a double pulsatile flicker. Looking on the left, I actually cannot make it out. If I could, I would test that it's venous by seeing if it filled from above is non-palpable, declines with inspiration, and I would assess its waveform character, particularly say V wave in in tricuspid regurgitation, and its height less than 3 centimeters. So moving on to the precordium, doing a general inspection of the chest, looking for deformities, scars, things like that. Looking for any obvious thrills or abnormal palpitations, pulsations I should say. Can't see any of that, so looking for the apex beat, which I'm expecting it to be mid-clavicular line and 5th intercostal space. Okay, I can't see that, so palpating in the same area, making sure that I get my fingers in between the costal spaces. I can't palpate the apex beat. It's normal not to palpate the apex beat in about 50% of patients, apparently, according to Telly and O'Connor. So moving on to palpating parasternally for thrills, which are palpable murmurs. No. Okay, moving on to the abdomen. So again, looking for deformity scars, blah blah blah. Feeling for a pulsatile liver. So just take a big deep breath for me. Okay, and the spleen. So starting medially. Another big deep breath. Okay, no pulsatile spleen. Palpating just superior to the umbilicus for the triple A. 2 fingers. Okay, not palpable. Okay, now I'll be auscultating. Starting with the bell and the fifth intercostal space, mid-clavicular line. Listening for heart sounds and murmurs. Moving to the, if you could just step for me and lean over just a little. Yep. Okay, just lie flat again, please. Now moving to the tricuspid, 4th intercostal parasternally. Okay, moving to the pulmonary. Just take a big deep breath for me. Okay, thank you. To the aorta, aortic valve. Okay, now just try to look up for me a little bit, please. So just take a big deep breath for me, please, and just hold it in. Okay, thank you. You can take another deep breath for me. Okay. And if you could just sit up for me, please. Just try and hug your knees if you can. That's it. Now just take a big deep breath for me, please. Okay. And one more time. Okay, just stay like that for me, please. Feeling for sacral edema, just percuss the bases of the lungs. You can lie down again, thanks. And auscultating for any pleural effusion. In the legs, check peripheral pulses, edema, cyanosis, and temperature changes and intermittent claudication. Thanks for watching, bye!